Hey, everybody. Welcome back to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. I'm Kirsten Nelsen, professional horse trainer, and with me once again, Dr. Anne Marie Hancock of True North Equine in Marshall, Virginia. And today's topic, Dr. Hancock's going to share with all of us some important things we need to know as horse owners about our horse's nervous system. Oh, and you have a friend there. I love it. I put my cats outside today. I'm like,
Yeah, this one was,
too
it'll be
much.
louder if he's out, so
Oh.
that's good.
So, what do you think as an osteopath? And we talked about that, and I know the nervous system is a big part of osteopathy or working with it. But what parts of the nervous system do you think are really important to understand, especially as horse owners?
All of it, right?
Well, and we did a whole podcast just on the vagal nervous system, on the
Right.
vagus nerve, and that is kind of a thing into itself. But
Yeah. I mean, I guess, I guess for most people, we should probably break it down first and just say that, there's your motor systems, your sensory systems, your special sensory systems, and then there's the autonomic nervous system, right? So all of those things are going to be a part of the nervous system, and we talk about all of it. So, when your conventional, regular veterinarian comes out and they're trying to find a lameness, they're working on the level of that, what we call the peripheral nervous system. So the little nerves that sense and feel what's going on under the skin in the horse's legs, right?
right.
So what the vet's going to do is they're going to put a local nerve block in and try to numb those sensory nerves to see if they can locate a problem. So, most people are probably really familiar with that part of the nervous system.
Yeah.
Does it hurt? Can we impact the pain? Or maybe they, had one that has had some damage to a nerve and then a muscle gets smaller because the nerve has been inflamed. So there's another common veterinary disease called Sweeney. And that's usually when a horse gets an injury to the shoulder and it
Hmm.
affects some of the nerves that come out of the shoulder and the armpit. And so you might lose like a muscle for a little while where the muscle atrophies and goes away. And then as the nerve inflammation goes away and the nerve functions again, then the muscle gets iteration, the muscle gets bigger. So when we
Oh,
talk about
interesting. So some muscle atrophy can be a sign of inflammation in the nervous system.
absolutely. Yeah,
Wow.
especially if it's local. So if you understand where the nervous system is, especially what we call the peripheral nervous system, so the nerves outside of the spinal column, then you can really start to isolate, oh, I think they have an injury to this nerve, because only this muscle is affected. Or, we can do all kinds of tests for droopiness of the face, right? Or,
Mm.
does the pupil dilate or does the eyeball move in all directions? And we can isolate a specific nerve that might be a problem based on what the body can and can't do or feel.
Or
So
even that little lip deviation where horses put
yeah,
their lips to one side can indicate like facial nerve damage.
right. And so the facial nerve is an example of a peripheral nerve.
Right.
It's leaving the brain in the skull instead of leaving the spinal cord, but it's going out and it's doing motor and sensory to the body. So when we talk about regular veterinary medicine, we're all trained to really understand that. What I get to do as an osteopath is I get to focus a lot on the autonomic nervous system and how that's innervated. And in veterinary school, they don't focus on that a whole lot. So I remember getting about an hour of anatomy on the autonomic nervous system and maybe a couple hours tops of physiology on it. It's just something that kind of gets glanced at, but not really focused on. Whereas when I was in osteopathic school, we had an entire, week's course that was just on the autonomic nervous system, and mapping it and understanding it was included in every single module that we took, because
And
it helped me to
the autonomic nervous system is the unconscious functions of the body, basically. And that's where your sympathetic, parasympathetic, vagal nerve all come into play is within the autonomic nervous system.
that's right. So the
Okay.
autonomic nervous system is what's responsible for regulating, like, how sensitive are your nerves? How likely are they to fire? You know, how dilated are your blood vessels? You know, how much of a specific neurotransmitter or hormone are you going to be making? You know, it balances out your blood pressure, it controls contraction of the heart, it controls peristalsis of the gut, you know, and blood flow to the GI tract. It helps control the immune system response, it controls reproductive, you know, systems, it controls blood to the brain, you know, salivary glands, how it controls the dilation of your eye or pupil, you know, so that pupil gets dilated when you're in sympathetic versus parasympathetic. So all these little responses that we don't think about are
Mm-hmm.
things that are regulated by the autonomic nervous system. And it's really unique because it has these two sides, you know, so we have something called the parasympathetic and something called the sympathetic nervous system. And most of us understand that now, you know, as parasympathetic is rest and digest, and sympathetic is fight or flight.
Right.
But when you look at it from a tissue standpoint, when you're doing body work, that parasympathetic is the more relaxed, mobile, healing portion of the tissues. And the sympathetic is usually the tissues that are much harder, more contracted, unable to move, you know, maybe
Mm.
more likely to be sensitive to touch, you know, all those sorts of things, swollen, congested, you know, those sorts of tissues are more of a sympathetic, you know, system
So are
result.
you saying that through the palpation of tissue, you can sort of tell which part of the autonomic nervous system is more active?
Right. You
Oh
can
my
use it
gosh, that's amazing.
right, you can use it to kind of help you figure out, okay, is this part of the body, you know, relaxed and healing? Is this part of the body congested and immobilized? You know, because that's one of the things you will find is that joints or fascia, when we say joint, it can be a bone on bone joint or a fascia on fascia joint, or, you know, a skin on, you know, tissue below it. So anything that should be sliding or moving that isn't, if it's rigid and tight and hard and immobile, it's going to be creating a sympathetic feedback loop to the body. So,
Interesting.
yeah, so where that becomes really important is when we start looking at mapping the nervous system and where do those parasympathetic fibers come from versus where do the sympathetic fibers come from. And then we can have a lot of fun figuring out where do different locations of immobility in the body, you know, create problems. Um, so, I mean, what I thought I'd do is just kind of briefly go over where they are, you know, and then I thought we could just do some fun examples so that people can start thinking about how does the nervous system affect the horse's body and vice versa.
Right, regarding performance or health,
Right,
really. Yeah.
exactly. So the critical thing to think about is that the sympathetic nervous system lies within the spinal cord in something called the intermediolateral column. And that column goes from the first thoracic to the second lumbar. So it's basically in the thorax. Um, and then what happens is there's a set of synapses right inside the spinal column. And then there's a set of synapses in the sympathetic chain, which is about maybe about 2 inches right outside the spinal column. And in most animals, it's right below where the rib joint is on the vertebrae.
Oh,
So if
interesting.
you have a rib that's being pushed downward on a horse, you're stimulating that sympathetic ganglion on that particular location. And if we think about where that saddle sits,
I was just thinking that's exactly where the saddle sits,
right, your
right?
saddle sits in the thoracic, you know, rib cage area because we need those ribs to help bear the weight of the saddle. But right where the sympathetic chain is kind of right where that hollow is sometimes that horses will get, you know, so you have the spine and then you have the little hollow and then the ribs come back up. But
Mhm.
right where that little hollow is, about 2 to 3 inches from the spine is where the sympathetic chain is. And it's just on the underside of the rib and all those muscles. So if you were looking up, you know, from the inside of the chest, you
Uh-huh.
see it. You can just see it sitting right there.
Wow.
Mhm.
Wow. So saddle fit and rider balance, and even with young horses, it made me wonder if part of a young horse's fear of carrying a rider has to do with a little bit of stimulating that part of the body for the first time.
Right? I mean, that's not a bad point at all when you think about if they're not very strong. So if we haven't done a good job of, building up those back muscles, right? Epaxial,
Hmm.
the ones at the top, right?
Yeah.
The ones that cover the spine. If those aren't built up and they have more of a hollow, depressed area there, then when you do go to put a saddle on or a rider or something like that, they don't have anything to help support the saddle, and they don't have anything to help lift the saddle right off of those ribs. So they
Right.
might be more likely to be pushing downward with their weight
On the top of the
and
ribs. Yeah.
and stimulating the sympathetic nervous system, right? So that's your sympathetic nervous system right there. And then the parasympathetic nervous system, when we talk about where that is it sort of has all these ganglions that come out of the sacrum and out of the brain, and then feed the rest of the body. So when we talk about areas of parasympathetic stimulation, we're looking at pelvic and sacral areas, and then we're looking at most of the ganglions come out right, behind the ears or, under the jaw. And then there's one other one that comes right down to the first rib. So right at C7, TH1. So those are our critical areas for impacting the parasympathetic nervous system.
Which is basically the lower, obviously, one is up by the skull, and the other one on horses is that sort of right between the front of the shoulder blades area?
Mhm.
Yeah.
Yeah, it's going to be deep to the shoulder blades. It's if you were to like kind of come around the bottom of their neck and curl in a little bit, that's where it is. So they're going
Okay.
to be like right deep right in here. Um, so I mean, those are definitely critical areas that we want to have mobile and not have any constriction on. We want them to be
So
functioning.
then that makes me instantly think of the bridle and the bit and the reins
Mhm.
and all of the sort of cranking and pulling, trying to get our horse's head set, how that could really wreak havoc on the parasympathetic nervous system.
Right. So if there's a huge area of release in people where they talk about releasing the base of the skull, because that's where a lot of those cranial nerves come out, and that's where a lot of the ganglions are, is kind of right in this area underneath the jaw and at the base of the skull. So if you have a horse that's in let's say a tight nose band, right, that immediately pushes the jaw backwards. A really tight noseband will kind of close the whole face up. So they end up with a clenched jaw a little bit. And sometimes they almost end up with a little flexion just because of the noseband. That, just that in itself can impact the mobility or the space that those parasympathetic nerves have.
Oh, and that's exactly what I'll see on some horses that have been sort of either balancing on the bit, held up by the bit, or just overly flexed through the neck vertebra, is there's a definite almost puffy congestion right in that area behind the upper jaw,
Mhm.
between the neck and the jaw. Some horses will be like there'll be edema there even, or an overbuilt up little muscle. But to me, it just looks like this congestion where things are kind of stuck because they've just been smushed backwards
Right.
with the
Well,
head and neck.
I love what you just did. I don't know if if anybody
Oh,
watches this or just, listening to it, but as soon as Kirsten tried to like put her neck into that smush face, like her whole body went into extension, like her whole neck went backwards and her back arched, right? So, we just think about that one little area of the neck that's getting compressed, but what does it do to the rest of the body, right?
oh,
This
you're
is
right. My back unconsciously arched and my pelvis tilted backwards. Absolutely. I didn't even notice that.
It's a really good illustration. Yeah, so I mean, that's a lot of times, I think what we have to think about with these guys is I mean, it doesn't matter where it starts in the body. It can start from the back forward or the middle or start from the front. There's lots of different ways to create that imbalance, but if we're focusing right now on those ganglions in the head, and how do they get compromised, then as they begin to get compromised and contracted, then they're having an impact on everything coming out of the head. But because of all of this spring, right, they're having an impact on the whole body. It's not just one piece.
Right.
I
Or
will say
vice
though,
versa. It could be a horse that's been chronically disengaged. Would that somehow affect the nerves around the sacral area?
I mean, you mean like if they're when you say chronically disengaged, are you talking about the ones that get twisted like to the side, or are you talking about
That
the
that actually is a whole nother podcast I would love to do with you, because
okay?
my definition of engagement versus disengagement is the stability of the SI joint and the sacrum, or the lack
Okay.
thereof. Like I go, that it to me is the only way I can kind of distinguish between disengagement in a horse and engagement, whether it's lateral or it's sort of front to back. Because as soon as, like when we look at the SI joint, that's not going to move. The whole pelvis itself, the bones are going to move before that shifts. But I'm imagining if there's all this ganglia of nerve around the sacrum, that's right in that area of the SI joint where the forces of the legs are transferred through the pelvis into the spine. And that's got to be a really big deal if there's all these kind of unstable forces acting on it. Even what we call a horse with a high croup, I go, that's the wrong direction for the
Absolutely.
sacrum.
So, yeah, right. So the high croup is usually the horse where the tail's sticking up in the air, right? So they sometimes have that little sort of hollow, kind of right in front of the pelvis, like where L6, the last lumbar would be. So the sacrum kind of dips down in the front, and then the back has a little hollow, and then they might have a hunter's bump.
Right.
So when we talk about that, absolutely, as soon as that happens, when you see that particular posture, you're actually putting the strain on the nervous system towards the back, towards the tail, right? So those meningeal structures in the tail are pulling backwards, and they're putting a lot of strain on the head as well, right? Because those structures are only so long. So if something at the back end is pulling backwards, it's also pulling and putting tension on the front. So you'll see strain on the cranial nerves and on the skull as well because of that strain from the back end. And then I think, like we're talking about, if we have parasympathetic innervation at the sacrum and at the skull, if that sacrum isn't mobile, or and pelvis can't move, and you have that sort of positioning,
Mm-hmm.
then you already have excess strain on any of those parasympathetic nerves that are leaving the sacrum, that are going to innervate the GI tract, and the immune system, and the spleen, and the liver, and the kidneys, and the reproductive tract, and the diaphragm, and the lungs. Like a lot of that is coming from the sacrum, and that's
Oh,
where that's
interesting.
coming from, right? So we can see maybe some changes in how well we're able to do healthy, right? So normal digestion can be affected, normal reproduction can be affected. A lot of times those horses maybe end up with asthma, and it can have asthma has lots and lots of causes, but maybe some of that is that they're not able to inflate their lungs as well because their diaphragm doesn't function normally, or the liver isn't functioning as well because the innervation is off, right? So, and
Right.
that's just the parasympathetic part of it. We're just talking about those two centers. Like
Right.
if there's a problem at the pelvis and the sacrum, or if there's a problem at the skull, and then the third area, of course, that's parasympathetic, is that, base of the neck, C7, TH1. And I think that area gets a lot of focus right now. We have a lot of people starting to talk about CEVM, so cervical equine vertebral malformations, and unusual things that are happening to the bottom of the vertebrae. So what they're talking about with these CEVM forms is not necessarily a narrowing of the spinal cord, although that can happen. They're actually looking at changes to the bone on the bottom of the spinal cord, of the vertebrae,
Mm-hmm.
that have to do with the muscles that attach there to actually elevate and lift the base of the spine. right? So what they're saying is that those muscles are not reaching as far, they're not supporting the base of the neck as well as they should be. So the base of the neck is actually getting dropped into more of a flexed position instead of staying more horizontal,
Mm-hmm.
because of that. So because of the lack of support underneath, we do see, some of the spinal cords get narrowed, that because of that, but it's sort of secondary to the fact that we don't have the support to keep that spine where it should be and keep it more horizontal.
And what about when horses are muscled the wrong way? Like when the muscle is actively pulling the cervical spine downward? Like,
Right, like the horses that have the big U-necked
yes,
position where they're more like just absolutely right. That's doing the same thing. So you're creating a problem for many things, but among them is this parasympathetic nervous system. Because when they get into that position where they're really high necked and they have all the muscling on the bottom, you're constricting the space where that we call it the stellate ganglion lives. And that has a lot of important innervations to back towards the head in the brain and the endocrine system and all kinds of things, hormones, neuroreceptors, control of the heart, all those sorts of things are impacted by um, constrictions in this area.
and that is that also why I keep seeing sort of in training terms or therapy terms for horses, the thoracic sling like has become such a big deal. And that's probably because it's part of that.
Absolutely. So thoracic sling is a big deal because of both nervous systems, right?
Right.
Because, the parasympathetic innervation that's important is that stellate ganglion, the first rib, last cervical, and where that innervates. But then, like, what did we say? Where's the sympathetic nervous system?
Right. It's
The
right there on
entire
top.
thoracic vertebrae.
Right.
So if you have a restriction in the thoracic spine, then you're going to have something that's going to probably cause immobility. And if you have immobility in the thoracic spine, you end up increasing the sympathetic level of innervation to the body. So when you do that, when you have an increased sympathetic innervation, you end up with more injuries, more inflammation, more congestion, muscles that are hypercontracted, unable to relax. You end up with excess cortisol in the body, which will cause damage over time, right? Fatigue that isn't being having time to repair. So you're
Mhm.
breaking down the body instead of repairing it. And when you're in that more sympathetic state, we call it the catabolic state. It's all about creating energy. So you're going to break down muscle, break down fat, try to run, mobilize the energy
Right.
sources, but you're not actually putting anything away and repairing it.
Right.
So if the horses end up with exactly that, if they have a thoracic sling that isn't mobile, they're probably going to be in a state where they are more sympathetic and they're more likely to get an injury
Yeah.
just because of that system being stimulated more.
Yeah. And that's where behaviorally we go, whether they're kind of high anxiety or snarky and a lot of tension. That's why we call it the fight flight nervous system, is because that's what we do.
Mm-hmm.
Um, and that's where the energy goes, is for immediate survival. But when it's held long term, it just creates more, it sort of keeps drawing on the body's bank account, I guess, and
Right.
just depleting and depleting and depleting.
That's exactly right. Yeah, I think that's probably a big part of the problem that we see in the modern show horse. They're it's multifactorial, right? But they show a lot and they start when they're young and they're being pushed a lot, right? So their sympathetic nervous systems are already sort of being triggered or being set up to be elevated just because of the life they're living, right? And then we, stimulate their sympathetic nervous system further by putting the saddle on, right?
Right,
Because we know that that's a right in that area. That's if the back isn't mobile and you're creating immobility with your saddle at all, you're stimulating more of that sympathetic nervous system response, right? So if we just perpetuate that, then we're certainly going to create more problems. And I think that's why we have so many horses that people are, giving away at 10 years old and saying
Yeah.
that they can't do anything anymore, right?
No, they're either lame or blowing up and unsafe to ride.
Right,
Yeah.
one or the other.
Yeah.
Either become behavioral or that inflammation cascade is, finally hit them where they just have so much inflammation in their body. They've had degenerative changes to tendons and ligaments and arthritis and, all of those sorts of things. If they haven't acted out, then they've
Yeah.
internalized and then you end up with all of the damage to the tissues.
Well, and even a lot of lamenesses, like some idiopathic lamenesses that aren't blocking out, even on front legs. I think our friend Deb had a horse that this happened to, intermittent lameness on the left front. Everybody's thinking it's the knee, it's the fetlock, it's the foot, but she kept blocking out fine on the peripheral nerves
Mhm,
until we x-rayed the neck, and that's where the pain was coming from, was she had developed some arthritis in her neck.
mhm.
And that was creating the lameness. So, sort of understanding that connection through the nervous system can really explain some lamenesses that are hard to diagnose, or
Absolutely.
chronic back pain, or inability to use the hindquarters, all of those things that can be mysterious if you're just using normal nerve block strategy to try to figure out the pain, where
Yep.
the pain is coming from.
And I mean, absolutely. I think what we're like trying to think about doing is trying to compare like where are the hot areas that people might see things and why might they be seeing maybe visceral problems, so an organ problem or some sort of other health problem that would be connected to those. And because that's really where you start to see the autonomic nervous system connections. So like right now we're just talking about like here's what happens to the tissues,
Right,
when you're in an immobility state versus a more relaxed state. But I think the other really cool part about looking at the autonomic nervous system is it doesn't just innervate the joints, it also innervates the organs and it innervates the blood vessels, innervates the nervous system and all those nerves that go to the organs.
right.
And you can start looking at almost like a roadmap of the body based on where the immobility is, and you can start figuring out like which other problems would the horses have, right? Based on where the immobility is. And
No,
so,
I think it was driven home to me. I had a horse he used to be a terrible pullback. And when I wasn't there, he pulled back one time on the cross ties pretty significantly. And he seemed okay at the time. But about a year later, he developed like a lump on his neck, upper neck. And I kept thinking, what is that? And I never really had it x-rayed, but he became kind of ataxic, like he had EPM. He got
mhm,
really unstable on his hindquarters and he started falling a lot and having trouble getting back up. And his EPM tests were fine. We treated him for it anyways. He didn't get any better. And it turned out we finally x-rayed that lump on his neck and it was a hairline fracture that had calloused and was just interrupting nerve information to the hindquarter. And I was like, wow, that's the neck injury. He just lost all stability through the hindquarter.
that's really fascinating. How far down the neck was it?
It was, I want to say, I'm not great. I want to say probably around between C2, C3.
That's really interesting. I just
Yeah.
saw one last month that has a fracture to the first vertebrae, to the atlas. It's been there for like a year now. I think I just saw the horse for the first time last month. Um, but he has like this big swelling on one side and he's very sensitive to, any sort of manipulation around his pole. Like he just wants to hold it in one place and stay stable. Um, you know, but I'm just wondering like at what point can I go back and even try to manipulate it, right?
Right.
Because there's so many things that are going on there. I mean, like, did you guys ever try to work on that horse and manipulate it, or did you just kind of sort of let him be and let him just put his head wherever he wanted to?
I don't think at the time I had anybody who was doing body work, and
Mhm.
and I didn't have a lot of access to different kind of therapies and modalities. but I just kept noticing it was a hard lump. I could touch his neck, I could handle him. He never seemed to mind it being touched, but it was
Mhm.
like the size of a baseball that
Mhm.
when he would turn his head a certain way, this baseball would kind of pop out of his upper neck. And I kept,
I could see that.
and he didn't mind having it touched even after he had had the pullback, but it was like it just kind of got harder and didn't
Mhm.
go away. And finally, when we x-rayed it, you could see all of the I guess it's technically arthritis, but all the bone that had sort of grown around
Yeah.
this fracture, and it was cutting off information through the nervous system to his hindquarters. Like his
Yeah,
brain was fine,
absolutely.
his appetite was fine, his blood work was fine, but he was just falling down, like
Mhm.
losing that much stability.
Yeah, I mean, I think that's exactly it, especially something up in the upper neck, because we were talking about all of those nerves come out there that do so much for the body, you know, as an autonomic nervous system thing, as well as the nerves that tend to be the most sensitive to pressure are proprioceptions in the hind limb because they're on the very outside of the spinal cord itself. So if there's any sort of pinching or impact to the spinal cord on the inside of the vertebrae, those will be affected before anything else because they're the ones that are squished first. If there's any
Mm,
pressure, they get squished before everything else does. And so that's why, like with EPM, we see hind limb problems, or when people talk about wobblers, it's hind limb. It's because those are the nerves that are the first ones that get squished when there's any swelling. Um,
interesting.
yeah, that is kind of cool to hear about that. Yeah, I don't know. Those ones are weird when they're up high like that and they affect the first few. I think that they also really affect the vagus nerve and the ability for them to swallow, and a lot of those nerves that come out right here, and can really affect those like specifically. So I see a
Interesting.
lot of those horses have immune issues. They're the ones that are more likely to have high parasite counts or get EPM or get Lyme, or if somebody brings in the flu, they're the ones that get it. Nobody else
Yeah.
gets sick, but they will. They're just not as robust as everybody else. I think they might also be more likely to get something like Cushing's, right? Because you're impacting the blood flow to the brain a bit more, so they
Mm,
might be more likely to have those sorts of, pressure changes or blood flow changes that impact the base of the brain more because of where that location is.
interesting.
Mhm.
And I think the first time I really looked at a good diagram of a horse's nervous system, one of the things that stuck with me, I wanted to ask you about, was it appeared like there was this giant junction box or ganglia of nerves just inside of horse's scapula. Is that the
Mhm.
peripheral nervous system or is that part of the autonomic?
That's peripheral. So that's
Okay.
called the brachiocephalic trunk.
Okay.
So we kind of have the same thing on the back end with the sciatic nerve, but because it's really all sciatic nerve on the hind end, basically, you don't see it as much. This is the other cat. But the brachiocephalic trunk is like what I was talking about with Sweeney. So you
Right.
have at least five, it might be up to seven nerves that come out like right near the armpit. And they all do different sections of the front limb. So one of them does the shoulder, one of them does the very front of the arm. There's another two that do the back and the side. One of them does more of the muscles that bring the arm forward. One of them brings the arm back. So I think those are all part of the brachiocephalic trunk. So you can figure out a lot about what got stretched or what got damaged, based on what muscles and areas of the skin are affected.
Oh, interesting.
Yeah, can be fun. Not for the owner or the horse
Yeah.
or the person learning.
Yeah. So how, like, sort of knowing these things about the nervous system, because if I have this right, the parasympathetic, like most of it is up in your thoracolumbar spine, just under where the ribs attach.
That's
And
sympathetic. That's the
sorry,
sympathetic.
sympathetic. and
mhm,
that's kind of where the saddle goes, where we sit as riders. And so weak back muscles, we can inadvertently maybe start stimulating that part of the nervous system more than we think we are.
mhm.
And the parasympathetic nervous system, kind of the important key areas are just where the skull attaches to the
Mhm,
spine, and
mhm.
then down on either side of what we would consider the upper jawbone.
Right. And
And
then right in the base of the neck.
and then the base of the
Again.
neck,
Mhm.
very base of the neck, and then the sacrum, which is up on top of the hindquarters.
Yeah. So one of the examples, I was trying to think of things that like take home messages, things that people might hear about a lot and what could they, think about or apply to their life would be stomach ulcers, right? So people worry a lot about their horse having stomach ulcers and why does it happen and how can I prevent it? But one of the things we can think about is which vertebrae are responsible in the sympathetic nervous system for innervating the stomach and the beginning of the small intestine, right? Because if we
Mm-hmm.
can impact those and keep them healthier so those tissues can repair, right? Versus staying in more of an immobile sympathetic state where they can't repair,
Mm-hmm.
then we can probably help some of these horses so they don't have to be on, ulcer medication, right? So the innervation for the stomach is the ninth, 10th, and 11th vertebrae, which is right
Thoracic,
about where the stirrup bar is.
where the
So
stirrup bar is.
yeah, right.
Interesting.
It's like about right where the girth goes and the stirrup bar is. So
Ah,
if we think about how many horses are lacking back musculature or have those hollow areas behind the wither, right? And they're being fitted with a saddle that's probably pretty tight or narrow, or that might sort of lean forward a little when the rider's in the saddle. So it's putting more pressure there, all of those things you could be inadvertently stimulating the sympathetic nervous system. So putting your horse at risk for stomach ulcers just by the position of the saddle or how it fits,
yeah, if it's impinging on any of that area.
right? Or pushing
Or
down on
even
the
like
base.
a lot of riders will stand in the stirrups
Mhm.
to kind of give their horses back relief. And it didn't make sense to me because the saddle spreads out the pounds per square inch. I go, that's the purpose of a saddle is to distribute our body weight over a greater surface area. And when we stand in the stirrup, we're basically concentrating our weight right where you're saying
Yes.
it's
Mhm.
connected to stomach ulcers.
That's exactly right.
Yeah.
So, I mean, maybe if the problem with your saddle was that it was tilting backward, right? And so you were putting too much pressure on the back of the thoracic ribs, then it might make sense to stand up, take the pressure off that area and make your saddle more even. But if your saddle is already even and now you're pushing forward on it, then yeah, you're creating a problem for those ribs and you're probably stimulating the sympathetic nervous system at the level of the stomach just because
Yeah.
of that. And the other thing that is interesting about that, particular area is then we talk about, okay, what's the vagal nervous system doing, right, for the stomach? And we know that for horses and for most mammals, the left vagus is much more involved in stomach innervation than the right. So if they have a problem on the left side with impingement, either at the jaw or at the base of the neck, along with the tight saddle, right? Now we have two problems that could be affecting stomach ulcer, cause or prevention,
And
right?
that's so interesting because like as a spinal function, what I find is there's no vocabulary in traditional or classical horse training that addresses the rotation function of the spine. And
Mhm.
most horses that we call left-handed, I go, they tend to have the dorsal side of the spine rotated a little bit left, and they overload and overcontract their front left leg.
Mhm.
And it goes all the way through the neck, the shoulder, the thoracic sling, and the upper back, where that gets really tight. And so that's actually a super common problem. like
Mm-hmm.
really common because we don't address it in traditional training, not even in classical training. Do we understand the levelness aspect that the horse has to maintain with correct rotational use of the spine?
Right.
So, and the
Absolutely.
way we're taught to do circles and lateral work is this excessive, massive lateral bending of the spine that's going to destabilize the rotation function. And so I go, it's a huge problem.
Mm-hmm.
And so what you're saying is just that can possibly alleviate or restore stomach function
Right.
to help overcome ulcers. That's amazing. And it's the exact same reason most people are over tightening their girth or they're reaching for sticky saddle pads and neoprene girths so that the saddle doesn't slide. Because how many people do you know whose saddle goes off to the left too often? I go, that's such a common problem. And it's really a spinal function that is the root cause of that.
That makes
And
sense. Mm-hmm.
yeah. And so a lot of riders, if that's the pattern that the horse has, that we call a left-handed horse, like that's how common it is, or my saddle always
Mm-hmm.
goes off to the left, we end up tightening our right side, but letting our body weight go the same direction. And
Right.
so
So,
that's just adding to the problem. And then we want a tighter or stickier girth, a narrower saddle, something to create stability because of that problem
right. And then you're just perpetuating the stimulation on that
on
part
that
of the
nerve.
stirrup bar, right? So
Hmm.
yeah, the whole saddle itself, just the struggle is then making it worse. You cannot go up there.
Yeah, no, that explains a lot.
Mm-hmm.
A lot.
So I think that one's a really cool example because it's just very simple. I'm trying to think. One of the other ones that I think is kind of interesting is looking at what's innervated around the back of the saddle, right? So how do we impact that, first lumbar, last thoracic, last couple ribs, so if your saddle is too long, right? And being pulled forward, so that your balance on the saddle is now tilted, where the saddle is kind of tilted to the back, then you're probably putting a lot of pressure, on those last couple thoracics and the first lumbar. So that actually impacts kidneys and impacts ovaries, so any sort of reproductive issues you might see associated with that area. It can impact spleen, just a little bit forward of that. So, it impacts the last little bit of the small intestine, so ileum, which is immune system. So any of those sorts of problems can be affected just by pressure and immobility on those, last couple ribs and the first lumbar. It's kind of interesting too, like just picking another area. Here's the things that we can see affected with
Yeah.
problems.
No, and that it just goes back to the importance of understanding saddle fit,
Mm-hmm.
and what
Very simple. Yeah.
yeah. And the
I think,
saddle moving around, I go, the saddle doesn't move around by itself. That's your
mhm.
horse's back doing something that's causing the saddle to move. And so if you address why the saddle's moving, you not only get better performance, but like you're talking about, you're affecting all these nerves that
Mhm.
are influencing vital organs and the whole autonomic
And
nervous system.
right, the whole health of the horse, right?
Yeah.
So like those ones are easy. Um, so another one that you might see is sometimes people will say, I put on my saddle and like after I work for a while, my horse always has to stop and pee. I don't know what that means. Like I've heard people talk about that, and the innervation for the bladder is the third lumbar, which is also the innervation for the stifle joint. And it's also the innervation for the skin around the flank, where it goes all the different directions. So
Hmm.
horses are really sensitive around their flank area, those things all are innervated by the same nerve. So sometimes, especially in like a Western saddle, Western saddles are really long
Yeah.
sometimes, and they'll go all the way back, and that skirt will hit L3. So I think that's usually where I hear that complaint a lot is trail horses, right? So they're in a big saddle, they're riding for longer periods of time, and they'll be like, after an hour or two, they, stop to pee a lot. I don't understand why they're doing that, but you're creating a little hyper, stimulation to that, one spinous vertebrae that innervates the bladder, right? So you're kind of stimulating them in a bit in that way to have to pee. So,
So I'll see a lot of, typically geldings will do this more often than mares, but even without a saddle on and doing groundwork, some horses will stop and act like they have to pee, but they don't. But they
mhm,
either park out because it's giving them some relief, or they think they have to go because something's being stimulated, but they don't actually have to go. And
mhm,
some horses will do that a lot. So are you saying there could be an issue around L3
mhm,
that's that a nerve
right.
issue that's kind of creating that problem?
I think so. Yeah. I mean, the L3 is innervation to the femoral nerve. So the femoral nerve is going to innervate the quadriceps muscles, all those big muscles on the thigh.
Hmm.
And it's also, like I said, innervating the tissue and the sensitive skin around the flank. And then it's innervating the stifle joint, and it's innervating the bladder and the tissue kind of in the groin area. So I think all of that combined, that's an area where they're doing a lot of work, especially if they're used to moving, sort of using their ventral side to do the motion versus using their top muscles to do their
Hmm.
motion. I think that area gets overused. The quadriceps get overused when they're weak. They use their quadriceps to kind of drag themselves forward versus
Right.
pushing with the muscles on their back. So I think it's probably a combination of all those things. Yeah.
Interesting.
Mhm.
Interesting. I'll have to look
Right?
at that more
You
closely.
can create all these little connections between things.
It is all connected, of course. Yeah. But this is why, when people tell me, like, if we're still in the frame of mind that we have a horse with bad behavior,
Mhm.
I'm hoping that these podcasts and conversations sort of open up horse owners' eyes that, the actions our horses take are usually giving us information. They're not doing it for no reason. I go,
Right.
the horse has a reason. We just don't know what it is yet.
Absolutely.
Yeah,
Yeah.
whether we
Well,
like it or not is a different matter. But I go, if we start to look at behavior as communication instead of going obedient, disobedient, good behavior, bad behavior, the
right.
horses will start to show us, even specific areas of the body where they're having problems.
Absolutely. Yeah. Yeah. And I think, we don't really think a lot about the chest and the horses as much because horses are bred to have really good hearts and lungs, right? Like that's their strong areas. So I think we get by with a lot more restrictions in the front half of their chest because they have enormous hearts and they have huge sets of lungs, right? So,
Right.
and you would have to do a lot for those to not function well enough. Whereas I think we see this stuff in the GI tract where we actually see clinical problems associated with those more just because they're really poorly engineered. Right. And so there's something wrong. We find out about it a lot sooner.
Yeah. Yeah. That makes sense because the weaker, less resilient area of the body is going to show the problems, even if the problem isn't originating there, it's going to be reflected there the soonest,
Right.
the
Right. Exactly.
easiest. Yeah. Well, thank you so much, Dr. Hancock. Is there anything else you want to add? But I think that really brings a whole bigger light onto the fight, flight versus rest and digest. Like it's not just all associated with behavior or fear, not fear. It's like there's all kinds of things that can happen by stimulating those nerves versus these nerves that we're probably doing inadvertently a lot.
I mean, I guess the only other thing I can think of that's really easy for people to go outside and look at, and see is there are particular stances in horses that you see when they are more in that sympathetic versus parasympathetic, body, style, right? So And I can definitely say, like, I can walk into a barn and tell you whether or not most of the horses are developing and healthy and they're in a parasympathetic state most of the time versus are they in a sympathetic state most of the time, which gives you a really good clue on how healthy will they stay, right? And
It's
I think
actually easy to see.
it's very
And
easy
once
to
you
see.
can
So
see it, you can't not see it.
right? So, I
Yeah.
mean, I think all you have to do is look at your horse from the side. And if you can kind of see that their ears and their withers and their pelvis are all at the same height, and that's a horse that's in a nice parasympathetic state. They're balanced, their body can develop, they can build top line. They're, going to be able to heal if they have an injury. It's that simple. Whereas if you see a horse that has, a body position where the head is more upright, and not at the same level as the shoulder, as the wither and the pelvis, then you know that they're going to be unhealthy and they're going to have more problems.
Yeah, and I
And
think it still gets called confirmation way too often.
but it's
And
not.
one of the things that makes me a little bit crazy is when people tell me that their horse has a high neck set and they can't, that's just how they're built.
Right,
And I go, well, then your horse couldn't graze. If that was really true, then your
right.
horse couldn't graze. So you agree that that's just, it's
Yeah.
posture, not confirmation.
I mean, there are definitely like, okay, Frisians have a different sort of position to how the neck comes into their body versus, maybe a quarter horse. But you would still see a Frisian in a relaxed state should still have his ears and his withers and his pelvis at the same height. And it doesn't have to do with, the curvature anywhere else. We just want those three pieces to be level.
Right.
So
And that's true whether it's an Arab, a saddlebred, an Akhal, an
right, doesn't
Icelandic.
matter.
It's like it doesn't matter.
Mhm.
Even if there is a slightly different relationship of how the neck does attach to the torso, you still have the ability inside of how the spine functions. That's not going to change
Right? I mean,
based on the breed.
you're not going to look at people and be like, oh, well, some people just have their head, 6 inches in front of their chest. No, like
Right.
they may, but that's not healthy. Like we should be straight. We all should be. And I think that if we got back to thinking of horses that way, it would give everybody a really good way to tell whether or not they have a healthy horse just from across the pasture. You could
Yeah.
look at anybody's pasture and be like, these are healthy or horses, or they're going to be able to cope with more. They're, able to handle things better than
When
horses
that's
that have.
their most prevalent posture is sort of that level between the pole, the withers, and the croup.
Yeah.
Yeah. And then what do you think also, and how does it reflect on the nervous system? When I look at muscle development too, it can tell me where the body's been working the most and where the body's been working the least, or what parts of the body are doing more and what aren't
Mhm.
doing their fair share. So to me, a healthy horse muscularly, I don't see muscle definition. I go a healthy muscular development to me looks like one big smooth muscle from nose to tail. And I don't see that sort of bodybuilder definition of muscle. Does that have anything to do with how the nerves are being used or how the muscle is innervated, or is it just muscle development or
It's
use?
probably both. What I bet it is what you're saying, and I've never thought about this. So this is me just trying to put this in words that
Okay.
make sense.
Thank you.
I would think if you have muscles that are very defined, like those hyper defined muscles, I think they're probably over contracted,
That's
right?
exactly
Like
what it
they're
is.
hard,
Yeah.
right? Whereas if you have muscles that kind of smoothly flow, they're probably all kind of balanced between stretch and contraction, in a way where they can do both in a healthy way versus being stuck in one direction or the other. So I think that's why they look so much smoother, is that the whole body is more balanced.
Thank you for that because it's like I still will come across people who are impressed with all this muscle definition on a horse that makes them look like a bodybuilder. Or some horses, some race horses, I go there, they look like greyhounds. They don't look like a
Mhm.
healthy muscled horse anymore. They look either like a greyhound or a bodybuilder. And every time I palpate the muscle, I go, it's rock hard. Like,
Right.
so I know when I can see that definition, that it's going to be a muscle
Right.
that's overly contracted.
Right, overly contracted and probably a horse and sympathetic, right? So they're
Yeah.
in that fight or flight, they're in breakdown. Yes, they're building that muscle up, but it's taking a huge amount of energy for them to do that, right?
And
Other,
maybe taking its toll on the digestive system or vital organs or immune system or metabolics.
absolutely. Yep.
Got it.
I like
That
that.
is so fascinating. No,
Very
and the
cool.
nervous system is like, it's everything. It's sort of how we perceive the world and it runs everything. So I go,
Hmm.
it's hugely important to have a little bit of understanding of how that works. And I love the details you shared today. Like even knowing the stirrup bar can be related to ulcers, or an extra long saddle skirt that makes the saddle too long for a horse could be related to bladder issues or again ulcers, right?
Yeah,
Or our
and gut
horse
problems.
being crooked, our horse being unlevel can
Hmm.
keep them in a sympathetic state.
Right? So it's just one more level. It's not just that they're crooked. You know, why do we care if they're crooked, or why do we care if their bodies are mobile? I mean, for us and for our horses, it's because it creates better health for everything. I mean,
Yeah,
everything.
and better performance. I go the two go hand in hand. A healthy
Mhm.
horse is always a better performer.
Yep.
And we think that we have to do all these things and push, push, push to get good performance at the expense of the health. And I go, it doesn't really work that way. What you get is your 10-year-old giveaway after
Right.
you've put $50,000 into this horse,
Right.
and it's like now you have an unusable horse.
Right.
So it really is in the horse owner's best interest to balance that health with performance every step of the way, knowing that you're going to get better performance no matter how talented or untalented the horse starts, and you're going to keep the horse longer. So your
Absolutely.
investment pays back and
Right.
probably fewer vet bills.
Yes. We want that.
Yeah. Well, thank you so much for joining us. It's always a pleasure to have you. You're just like this wealth of information every time I interview you. I love it.
Oh, it's fun to be here.
Good. Good. So thanks for joining us, everybody. We'll wrap it up for this time and look forward to seeing you on the next episode. Thanks so much.